There's a lot of work coming out now, I think, looking at kind of both sides of the spectrum with regards to what dietary factors are problematic for brain health. I mean, there's certainly ways that people can eat that promote kind of an inflammation and an inflammatory profile that's going to feed forward and not be good for the brain. And then on the other side, what are the factors, and what's kind of a good macronutrient ratio and what micronutrients are really critical for optimizing brain health. And one of the things that we're seeing, and it's, it gets to this idea that in terms of what's happening with how diet's influencing the brain, there's many mechanisms that can be affected. But one of the things that we're seeing in our data is that as you get older, there's also peripheral metabolic impairments. And this happens in rats, similar to it happening in humans. And so, at the most basic level, when someone switches onto a ketogenic diet, whether it's a human or a rat, if they have a metabolic syndrome or are pre-type 2 diabetes, the diet relatively quickly restores that. And then following that, we start to see beneficial effects in the brain. And so we're trying to tease apart, the role of improving peripheral metabolic health, which is going to improve brain function, as well as the direct benefits of the diet on the brain that aren't being mediated through peripheral factors.